When there's an accident or a fire, we call 911. And among those who respond immediately are paramedics and emergency medical technicians.
At least that's what's supposed to happen. But like every other sector, emergency services around the state do not have enough people to fill every position. So what happens when you're in an emergency and there isn't anyone around to get there quickly? News Center Maine's Carly Dion went looking for that answer.
It's a problem the emergency medical services industry has faced for many years. Now it's at a crisis level.
Every time someone calls 911, we facilitate that response.
Chris Lavoie is the director of the Penobscot Regional Communications Center. He oversees Bangor dispatchers who answer 911 calls and send emergency crews.
On a daily basis, we're having to send ambulances outside of their primary coverage area to other towns to help cover medical calls.
Lavoie says his dispatchers are frequently calling as many as 7 departments to find a single ambulance team to respond to a call. That strain in turn leading to longer wait times for those in an emergency.
My employees are the ones that are stuck on the phone with the distraught family member of the person who needs care.
Emergency medical services is a critical piece to the healthcare system in Maine, especially given our rural nature.
Windham Fire Chief Brent Libby is the board chair for Maine EMS. The board recently sent resolutions to the governor's office and the Maine legislature asking to make EMS an essential service. That would elevate ambulance personnel to the status of firefighters and police officers, essential, affecting staffing requirements and service standards.
There's not a vast pool of people that are trained and ready to go to work that are just waiting for an opening like there once was.
Lavoie says while the resolution is a step in the right direction, it's not enough to recruit the people needed to staff these departments.
We need to focus on recruitment and retention and taking care of our employees.
He says higher wages are needed as well as funding to educate those interested in the field. Lavoie says EMS work can't rely on volunteers.
I don't think there's a short-term solution to this problem because there's one thing that you can't rush, and that's education.
Lavoie says the next step is to start calling on state legislators and senators to take action. Carly Dion, News Center, Maine.